Hi everyone, it's Kevin. I'm the founder of Osana, and I'm here to tell you about how we're going to make our Australian health system more sustainable. I'd like to tell you about the problems I've observed in 20 years of being a doctor, and that is our health system is very reactive. We tend to only see our doctor when we get sick as patients, and so we don't always focus on prevention, and largely we don't always have the time to focus on preventative activities. So fixing things before they actually become more complicated and impacting a patient's health and well-being. The second challenge we have is our health system pays mainly for activity. Medicare pays me to see patients, so a volume of activity, and the same thing for hospitals. Hospitals get paid for admissions and activity, not always for the outcomes they achieve. And then the third is we don't always provide a good experience for patients. Patients, particularly with chronic health conditions, can navigate through the health system and get bounced around, and it's not always a pleasant experience. Sometimes they fall through the gaps. So these are some of the challenges that I think Osana can tackle. And the way we're tackling this is to look far and wide around the world to look at models of healthcare that can do better. And we've brought and distilled what works overseas into a model that we're testing in the Australian market. So we're finding like-minded clinicians, GPs and clinicians that want to do better for their patients. We're really investing in prevention, so building a team of care managers that look at all the gaps that patients might have with chronic health conditions. We're making sure that nothing is missed in their healthcare to keep them healthy, happy and out of hospital. We're building a team of health assistants that can access services for patients and really support them as they journey through the health system. We're creating clinics that have a completely new experience, so exercise classes, educational talks, and through that we think we can engage patients in a very different way so that they're charged with the right knowledge and the right skills to take charge of their own healthcare. And most important of all, we want to focus on health outcomes. That's what we want to be paid for, is delivering a better outcome for the population of patients that we're serving. And this is a drastic shift in our mindset and how we want to behave across the board, across our 3 clinics in Sydney. So that's a little bit about how Osana is hoping to provide a very different experience and how that is our contribution to making our health system more sustainable.